Hey everyone, I'm Lauren Fleming, founder of Him Supportwear, and today we have another installment of our Expert Spotlight series. And we are meeting with Dr. Miller, who's a PT DPT. She's a pelvic health specialist, physical therapist, and co-creator of Move Through Motherhood, which is a program supporting women through pregnancy, postpartum, and beyond. She has a decade of experience in fitness, physical therapy, and holistic healing. She specializes in pelvic health for all ages, driven by her own journey with prolapse, diastasis recti, and pelvic floor recovery. She's passionate about normalizing pelvic health and bridging the gaps in maternal care. She helps moms regain their confidence in their bodies while also treating infants with oral ties, tension, and feeding difficulties. She uses visceral mobilization, craniosacral facial therapy, and integrative techniques to provide gentle, effective care for lasting results. She's currently based in Willow Park, Texas. She's a mentor, educator, and advocate for pelvic health, making it approachable and empowering for every mom. We are so excited to have her with us today for this discussion.
Hey everyone, I'm Lauren Fleming, the founder of Him Supportwear, and today we have Dr. Hailey Miller talking with us, and we're so excited to have her on and talk with us about all things pelvic health. So Hailey, will you tell us a little bit about your background and what inspired you to work in this space?
Yeah, thanks for having me. So I started my first or like second career as a personal trainer and fitness director. I did that for like 10 years, and I just kind of felt called to do something more to help people more holistically, and just felt called to the medical field, but didn't want to become a nurse. So I went to PT school and just kind of was a natural path. I didn't like going to school, but going to PT school introduced me to the pelvic health specialty, which I just felt really drawn to because it was just an area of our healthcare system that isn't talked about or addressed. And I found myself just really comfortable talking about the uncomfortable stuff. It just kind of felt more natural. And, I just felt like it was something that a lot of people need and are missing.
Great. Yeah, thanks so much for sharing that. I think it's always interesting to hear like how people's different journeys and how they come into this space. And I think, talking about those uncomfortable conversations, like there's a lot of people like yourself where it just I don't know, there's just not a pause to it, which is really nice for people who
Mhm.
are talking with you because it just feels very like comfortable and you can feel, confident having those, which, sometimes hard conversations. So that's great. Thanks for sharing.
Yeah, yeah.
Will you tell us a little bit about what a typical day looks like for you in your practice?
Oh man. Yeah, I feel like I stay pretty busy. I'm always on the go, but as far as patient care goes, I treat a lot of people. I see infants, children, men and women, but the majority of my patient population is women who are pregnant, postpartum, or preparing to get pregnant, and or even older in perimenopause, menopause stages of life. So patient care looks like treating infants after birth for like muscle tension to help with like sleeping, feeding, gas, digestion, just overall tension that they may have developed in utero or after birth. And then working on mom for like during her pregnancy to help with tension, aches and pains that come up, postpartum, dealing with a lot of moms recovering and helping with them just returning to normal function and feeling confident as a new mom if it's their first baby, or just kind of getting back to their routine with their other kids and work and returning to activity. Outside of patient care, I'm doing a lot of like social media education. I try to put on courses for other health providers to help educate them on like better treatment strategies, just holistic treatment strategies to make sure they're addressing the root cause instead of just looking into the pelvis for the issue. My main passion is like education, and so I'm just kind of in between my patients working on that on my free time.
Great. Well, I feel like that's such an important part of this. I mean, setting aside the healthcare provider aspect, I feel like for the general public and like finding you through social media or things like that can be really helpful because a lot of folks, I feel like it's not until they have a problem that they really like learn about public health, pelvic floor physical therapy, like what does all this mean for me? And so to the extent we can have more professionals like yourself putting out like good quality content, it's so helpful because that education is such a big part of this, I feel like.
Yeah, it really is.
Um, what so for someone who maybe is like newer into pelvic health or like doesn't know a lot about it, how do you explain the importance of it to someone coming, with that kind of background?
Yeah. I guess for somebody who isn't new to pelvic health, I would say like your pelvic health is like the key to your health in general. It's like your foundation. I typically tell people, if something is off in your body, your pelvic health usually tells you. As long as you're listening and know what the signs and symptoms to look for, it's kind of like the key to how your body is functioning. So it's kind of like our indicator of our bowel, bladder, sexual health function, our stability and posture, and also like our circulation and lymphatic system health.
Yeah.
So if those are off, even if you're stressed, the pelvic floor will respond. So it's literally, it tells you everything. Some like lifestyle indicators like stress, nutrition, movement. If you're not moving well, your pelvic floor will definitely respond. If there's structural stuff going on, it definitely will give you some signs like pain, pressure, that kind of stuff.
Sure. When I like hearing you say that, because I think it's interesting how just tightly integrated it is with like our whole body system, that physical, mental, emotional. And yet a lot of people don't know about it. And so as you start to learn about it, you're like, oh my gosh, like this low back pain, like it's all related. And I've seen, stuff recently, like with, corrections to like your feet and how like I don't know. It's just, I think it's really fascinating how interconnected it all really is. And then for me, it's one of those things, I forget the term of like, once you hear a word that you've never heard before, and then you're like hearing it everywhere. I feel like that's kind of like how it can be for folks with pelvic health, pelvic floor. It's like you may have never heard that before, and then all of a sudden it's everywhere, is kind of how it feels.
That's for sure. And I know if you say something in a room and your phone's there, you're gonna get all
Yes.
the ads and
Oh, I
like
know.
targeted
My
reels on
husband and I
it.
talk about that all the time. We're like, it's always listening.
I know.
Oh, what are some of the biggest myths or misconceptions that you come across that you feel like we really need to work to address and educate on?
Oh man, there's a lot in that department. I guess like it's I guess from a broader perspective, we hear a lot of like, oh, that's just part of motherhood. That's just normal to experience as a woman. Like any pelvic floor dysfunction is dismissed and, thought of as, oh, that's just normal and part of like being a woman. And it's not true. Like all that stuff it's common. It shouldn't be normalized at all. And there are so many things like that you can do to help with it. And like leakage, that's like one of the most annoying myths, like, oh, you're just going to leak after you have kids. But some people even leak when they don't have kids. So it's just, where they're getting this information is probably not from a good source, or they just haven't been educated on pelvic health and how everything is interconnected, and how different systems influence your pelvic health. But that's just one of them. I can go on.
No, I know, and I feel like that's such a big one, and I think it's helpful to hear that, because I think sometimes folks, I mean, especially like new moms or really just like women in general, I feel like we put up with a lot before we'll go and seek help for it. So I think it's helpful to hear that while these things are common, there are things that we can do about it to help, because so many of them like drastically impact quality of life. And so while your immediate reaction might be like, oh, well, this is just how it is, I'm just going to put up with it and put all these other things into place to deal with it, knowing that there is tools and resources to help. Like if something's bothering you, it's really worth your time to try and figure out if you can help remedy it versus just dealing with the symptoms, because I think more often than not, there's something that can be done. And I think that's important.
Oh yeah, big time.
Mm-hmm. So I know, of course, like pelvic health is like very unique to the individual, but can you share with us kind of some general like habits or best practices that can be applicable to a broader population?
Yeah, I would say maybe some habits would be like not gripping certain parts of your body, like just checking in with yourself and like, are you clenching your jaw? Are you tensing your upper traps? Are you tucking your booty under to hold yourself up? Or even your toes, like, are you gripping and curling your toes in your shoes to find stability? Breathing is a really important one. I think that's something that I go over with everybody who comes into my office. And even not in my office, just day to day, I'm like, you should take some deep breaths. Like, let's breathe and learn how to breathe, because that rib movement will help that spine move and the sacrum move and the organs pump as you breathe in and out. And it also helps with stress and focus and sleep. So breathing and just like body awareness, like what are you doing? What is your body feeling like? And just checking in throughout the day. Those are my top two just to help with everything.
Great. Yeah. Thanks so much for sharing that. I feel like folks, should be able to easily relate to those. And it's ones that when you do start to pay attention to them, I know like the clenching and the tension is one for me early on where like I don't know, you just don't think about it. You didn't realize it. And then once you're made aware, you're like, oh my gosh, I'm doing that all the time.
Oh
And so
yeah.
just having that, yeah, that reminder to be like, okay, relax those muscles, let the proper ones like
Yes.
take over is really
Yeah.
impactful. Will you talk to us a little bit about how pelvic health comes into play? We could focus on women like at different phases of their life, a high level, because like I know a lot of folks, it's not until maybe postpartum and something's gone wrong that they might be introduced to pelvic health. But I think having that more proactive lens and then
Mhm.
understanding how it can come into play over the course of someone's life could be really helpful. So I was hoping you could talk to us about that.
Oh yeah, I usually start with childhood stuff too. So women, with history of like chronic constipation or
Mhm.
history of like gymnastics or like lots of athletic sports
Like
that they've
impact. Mhm.
participated in. Yeah, that impact and that tension that they've just developed,
Mhm.
that mindset of like performance and,
Yeah.
competition that definitely tells you what that person's body is going to feel like. So different stages of life, like younger adulthood, tension and lifestyle management, like nutrition, sleep, stress, just your basics are going to help, will influence your pelvic floor health. So if we're on the go, not drinking water, not eating well, not mobilizing well, we're typically going to develop some kind of pelvic floor tension, which could present as like back pain, hip pain. But that's where pelvic health like therapy can come in too, to kind of show you what to do and how to like change your life a little bit just to help you in the future avoid future pelvic floor dysfunctions. But I would say another like area of life, like perimenopause, is pretty
Yeah.
not talked about. Like it's something that we're not really aware of, and I think it's happening earlier and earlier, because of our lifestyle, because of our food choices and stress, and our culture of being, on the go all the time and not
Yeah.
slowing down. And that comes like I see a lot of pelvic floor dysfunction with like pain with intercourse or any type of penetration. And then just perennial pain, vulvar pain, sometimes, the prolapse symptoms and all just vaginal dryness and all the other stuff that come along with hormonal changes. There's so much more to hormones that we aren't really educated on as,
Yeah.
in the public view. And then menopause, there's a lot of pain with intercourse too that we don't talk about, and
Right.
vaginal changes, vulvar changes, and just overall muscular, like skeletal changes that we don't address. And we should be working on all of these things, before these stages of life.
Right. No, thanks so much for sharing that because I think it's helpful to hear at all of these different milestones, the different things that can come into play. One, so you can be more mindful of them, and then two, like to the extent you can get ahead of it, just I feel like that more awareness is better to help folks kind of understand how things can change over time and what you can be paying attention to and be proactively working on.
Yeah.
Yeah, I think that's great. One of the things you were saying earlier was like how you also do like classes to help educate other professionals. I'd love to hear a little bit about how you stay up to date on, the latest research or trends and breakthroughs in this space, because I feel like it seems, there's a long way to go as far as like research and advances, it still feels like things are changing pretty quickly and there's more and more things coming out. I'd love to hear how you stay abreast of all that.
Yeah, I feel like there's so much to learn. Like I'm still constantly learning and taking classes and stuff like that. But I think the research, like my colleagues and I, we all share like articles and resources. We also
Cool.
like get connected with midwives and gynecologists who also have some up-to-date research, and we just kind of keep our eye out for new information. But I also just love taking like classes, courses to learn more techniques and different approaches to pelvic health dysfunctions. And I think a lot of it is just learning from each other and different case. We do a lot of case connects, like meetings where we like collaborate and care, like how we can help really difficult patients who have a lot going on that were like stumped. We're like, well, what do we do? And so we
Yeah.
just bring all of our minds together because it's, it's better when you have more people to collaborate with versus just one brain.
Yeah, no, that's great. Thanks for sharing that. Will you tell us a little bit about what you find as some of the most rewarding parts of the work you do?
Oh my gosh. There's so many. I think my most favorite is like seeing moms after like they've had a really difficult pregnancy the first time and they didn't go to pelvic floor PT, but I get them after they've had their first kid, and then taking them through pregnancy and showing them like how they can enjoy it and not move without, move the pain, and they can just enjoy their pregnancy a little bit more. But more importantly, like the labor prep, postpartum prep during pregnancy is game changing because after they have their baby, their body is just more prepared to like heal and recover because they've done all the work beforehand, so they can enjoy postpartum more. They have all the tools and the resources. And I love also educating on like infant care and like what you can do to help with all that stuff. So mom and baby are more successful afterwards. So, even if she's dealing with pelvic health issues like leakage, tailbone pain, or prolapse symptoms, she can have those resources and tools before she experiences them, so she can know what to do with her baby and her kids.
Well, and I love that piece because I think that knowing about it before you experiencing it can also help so much mentally. Like I know personally, thankfully I had like good resources in place to work with the pelvic floor PT after the birth of my first kid, but I was still completely blindsided by my prolapse diagnosis. In my postpartum experience, the second go around compared to the first was night and day difference. And I think a huge part of that was even just knowing what to expect. Like I know what these symptoms are. I know like what this road looks like. And just, I don't know, it's so impactful understanding like what can be going on and then what you can do about it versus like, bam, this has happened. And then what on earth am I going to do?
Yeah, I would agree with that. I have a lot of moms who come after their first kid and they're like, I have all these like crazy symptoms and pain. And my midwife or my gynecologist said, oh, that'll get better with
Yep.
time. But they're
Yep.
struggling and they come in so defeated, so just hyper aware of all their
Yeah.
symptoms that they can't truly enjoy being a mom and where they're at in that life. I went through my first pregnancy was rough. And then the labor was fast. So baby came out in like under 5 hours. It was very intense. And I got to experience the, uncomfortable prolapse symptoms. And I was just like, why is this happening to me? I should know how to help with this. But it took me a long time to recover. Even as a pelvic floor therapist, I was like, what am I missing? And it wasn't until like I looked outside my pelvis to my feet that things went away. And it was crazy. It was like you can't PT yourself. That's the thing. Like you have to have other people to kind of help you check in with your whole body.
Yeah, that's so interesting. Um, would you mind sharing a success story of somebody you've worked with? Yeah, that just would be helpful for our community to hear.
Yeah. Man, there's a lot. I'm trying to decide. Okay, there's one. I know there's so many good stories, and it's just really fun to share them. But one of my patients, she came to me after her first baby, having a lot of prolapse symptoms like pressure, heaviness, and we rehabbed her throughout, like before she got pregnant again. So we like got her fitted for a pessary, and we did a lot of like strength training and mobility to help her. She came back to me pregnant again, and she was like, "I need to enjoy this pregnancy again." Throughout pregnancy, I got to treat her, and she was able to keep up with her yoga, like walking, and her older kid. And then her birth was really like just different in a good way from her first experience. She didn't have a lot of like medical trauma. It was more enjoyable. She got to like just be present with her baby and also understand how her body was working. And she just told me like how, postpartum, how life-changing it was for her to be able to enjoy that immediate like postpartum like bonding with baby and not have to worry about her body and what it was feeling like. And she'll message me every now and then. She's like, I'm still so grateful. Like this has been so helpful. Even now, like her kid is like 2 years old and she's just like, I feel so different with this baby than I did the first
Yeah.
time. And together, we like just they feel it's just happier. Everybody's
Yeah.
happy. They're moving
Right.
better, feeling better.
Yeah, that's amazing. And you know, it's so important too because it impacts so many different aspects of your life to be feeling that way. It's like you as a mom, how you show up for your kids, how you show up for your family members. I mean, it shows up everywhere. And
Yeah.
so I think it's
Oh, yeah.
really cool to get to hear that because it just shows like how transformative that can be. And you know, it's interesting. I can relate in the sense of comparing like a first pregnancy and postpartum to a second. And I think that's something I'm hearing more and more too, where folks maybe had an experience the first time and then are working to remedy that the second time. It's also interesting because then along with that comes, I don't know what the right word is, but feeling disappointed with how the first one went. And so then it can be
Yeah.
hard to be like, oh, if it had been like this with my first. And so that plays its
Yeah.
own like,
Yeah. The
you know, kind of
guilt.
mental load with that too. So I don't know. It's such a complex
It is.
journey for so many different reasons.
Mhm.
Another thing you know, I think about, especially for folks postpartum, is how they can, you know, make time and energy and space to like show up for this, and how partners, family members, friends like can really help somebody who's working to work with a pelvic floor physical therapist and kind of go through that process. Do you have any like tips or advice for how partners or that significant other can really help show up and support the person that's working with you?
Yeah. I usually, the first visit with somebody postpartum, I'm usually like, don't worry about doing all the things that we discussed. Just being aware of them will help you integrate it into your day-to-day stuff, but also ask for help. Like ask your partner to like support you, help them remind you on these things that we talked about, like the gripping, the breathing, and taking time for yourself to kind of like step away from your roles and your responsibilities so you have time for yourself to kind of decompress, and just let your partner know what's really important, as far as like your healing and your recovery and what you need from them. And communication is a really important thing for them
Yeah.
at that stage of life. Like when you are feeling those pelvic floor symptoms, it can just be overwhelming and you just are hyper aware and just very sensitive to them, that it kind of almost blocks out everything around you, where you're
Yeah.
like, I don't, maybe my husband's there, but he's not really present with me, or my baby's here, he's not really present with me. And I'm just in my body experiencing these symptoms, and just kind of like taking that step to bring awareness to those feelings, and bringing your partner, bringing your family back in to help support you, so you're not alone in that. I think that's been the most helpful for like moms and people to help them recover better.
Hmm. Yeah, I think that makes a lot of sense. Thank you for sharing that. Just as we kind of start to wrap up, is there one thing that you wish that everybody knew about pelvic floor health, or like kind of your one thing that you like to, or you feel really passionate about?
Yeah, I think it's the most magical like therapy ever. Pelvic health therapy can really help with everything, because it's not just like the pelvis that we're looking at. It's literally how it's all connected, head to toe, inside and outside. And if you've just been experiencing weird symptoms or weird pains that just aren't addressed with normal stuff, like go see a pelvic health therapist, because they're usually going to explore out, inside and
Yeah.
outside to figure out where it's truly coming from. It truly is like amazing and magical,
Hmm.
because it can help with a lot of issues.
Yeah, no, I think that's huge. You know, and with you saying that, it reminds me too, like since I've let's see, almost 3 years postpartum with my second, but I've kind of shifted into this mode where I'll still see my pelvic health PT annually, and I just kind of like pair it with my OB appointment, and just like, okay, I'm going to that one. I also like to see her because they're addressing two very different things,
Mm.
and then it just helps me keep that relationship up and just kind of stay um in tune with like
Yeah.
how things are going. And so that's been a helpful approach, keeping in mind how important this is, kind of, if you can, not only go for that help when you have an issue.
Yeah, that's so awesome you do that. I love that. I have a
Yeah.
lot of patients
Yeah.
who do that too, and I'm just like, you're so good. I wish I could do
Yeah.
that.
Right.
But I have
Yeah. But no,
coworkers
it's
to
so
help me
helpful.
with that if I show up. But
Right.
yeah,
No, it's been
that's
great.
awesome.
Okay. Is
Yeah.
there anything else, Hailey, you want to leave us with as we wrap up?
No, I don't know. Just breathe.
A good one.
Breathe and don't clench.
Perfect. Well, thank you so much for talking with us today. We really appreciate your time.
Thank you.
All right, folks, so that was our episode with Dr. Hailey Miller. We're so glad that you joined us today. If you liked what you heard, please like and subscribe to our channel for more conversations about pelvic health and helping us raise awareness and impact more people positively everywhere. Stay tuned.